We are not back. We are back. Welcome back to our next Tuesday topic, some technical difficulties. Today we're going to talk about spinal stenosis. So stenosis literally translates to narrowing of the canal. So this can happen via a disc herniation, but I'm going to talk about today basically age-related changes, degenerative changes in the spine that lead to narrowing of the canal. So when we have that arthritis, when we have some of those degenerative changes in the spine, it basically shrinks the space where these nerves come out. It can happen in between the discs, or it can happen back by the spinal cord where the nerves come out. So basically when we have that arthritis, some of those bone spurs, stuff like that, it basically narrows the area where those nerves come out and gives us a nerve irritation. So people that have leg symptoms, people that have, weakness, stuff like that, they probably have stuff coming from the low back, impingement on those nerves basically. So when we see that, and typically it's the older patient, we need a few things for their spine. One, we need a directional preference, and we've talked about this in the past, a way to move their spine to basically centralize their symptoms, get symptoms out of their legs. And for those spinal stenosis patients, a lot of times that's lumbar flexion, flexing the low back to basically open up the canal, open up those areas where the nerve roots come out. So that's one piece, giving those nerves a little room to breathe. The second thing is getting the areas above and below, in this case the lumbar spine, getting the areas above and below that to move a little bit better so that there's not so much movement down there. So getting the mid-back, the thoracic spine moving better, how to move their hips and getting more mobility in their hips to basically take pressure off of the lumbar spine. And then the third piece of that puzzle is basically that IAP, the intra-abdominal pressure, the ability to stabilize their spine in the best possible way. This does a couple things. It basically decompresses their spine instead of locking down, turning on all these muscles, jamming up their back. It actually works to decompress and give those nerves some room to breathe. And it also keeps the other areas of their spine moving better. So when this pressure is right, their thoracic spine is going to move better, the hips can function better, everything basically works a little bit better. So when we get that diagnosis of spinal stenosis, often in the neck, in the cervical spine, or in the low back, it's not really a death sentence. We got some options. There's always an answer to get those symptoms to be better. So hope you learned a little something today. Thanks for watching, guys, and we'll catch you next week.